Dr. James Edward Mangaoil, otherwise known as Jed. I am the Medical Director of the Davao Doctors Care Center, Dumoy. This ambulatory surgical clinic in Davao Doctors Care Center, Dumoy actually started last 2017. This came about because some of our patients that we cater in the Davao Doctors main hospital sometimes could not really afford the services of the Davao Doctors main. Together with some of my colleagues, we formulated on how to cater this patient. What is an ambulatory surgical clinic? It is an establishment with the main purpose of providing surgical services on an outpatient basis and whose recovery should not exceed 24 hours. An ambulatory surgical clinic is definitely advantageous in low-risk patients. What do I mean by low-risk patients? These patients are young patients, patients with no comorbid conditions, and the procedures would just entail expertise on the part of the surgeon. Now, what is the difference between an ambulatory surgical clinic and an inpatient facility such as a big hospital? Of course, as the name implies, ambulatory means na ang patient would just come in, ang patient will just walk in and have the procedure or the operation done, and then after the procedure, the patient can go home, makauwi na siya. Unlike an inpatient operation where the patient magpa-admit pa siya, and then after he will be operated on, then stays for another day or two for recovery, and then goes home. No? That is why it is very important to select patients in an ambulatory setting. And when we operate on patients in an ambulatory setting, the patient goes home and turns out that the bill or the cost will be much cheaper compared to an inpatient facility. Now, why is that so? Of course, there is no room that will be paid for. Lesser personnel will be catering to the patient compared to the admitting institution. No? So, one of the factors that really would determine an ambulatory surgical clinic's success is the expertise of the surgeon and the capability of the ambulatory surgical clinic. Because if you put both of these together hand in hand, you would definitely have a good outcome for patient's recovery. The surgical cases that are catered here in Davao Doctors Care Center, Dumoy are breast surgeries, neck surgeries, hemorrhoidectomies, hernia surgeries, excision of soft tissue tumors, debridement, plastic surgeries, vascular surgeries, and we cater to industrial injuries. Davao Doctors Care Center Dumoy Ambulatory Surgical Clinic is located at Dumoy, Turil, Davao City. So if you have patients, if you have neighbors, if you have relatives or friends who need quality surgical service, good risk on an outpatient basis, you can refer the patient to Davao Doctors Care Center Ambulatory Surgical Clinic for a good quality operation. Once again, this is Dr. Jed Mangaoil, Medical Director of Davao Doctors Care Center, Dumoy Ambulatory Surgical Clinic. Thank you everybody, stay safe, God bless, and have a great day.